Okay. Thank you for joining, folks. We're going to give everyone just a minute to get connected. So thank you all for being here. My name is Kristen Mackey. I'm the Community Relations and Outreach Program Manager for WA Cares Fund. I am really pleased to have a fantastic panel joining me here today to talk about their experience, their work in this area. So we will get started with some brief introductions and talk a little bit about why we're here, why this issue matters. Then each panelist will have some time to give an overview of their work and their programs. And then we will also have a brief overview of the WA Cares Fund, Washington State's new universal long-term care insurance program, and how it will help address some of the issues that we're talking about. Then we will open up for discussion and audience Q&A. For those of you who joined on a computer, you can submit a question for our panel through the Q&A function, and you can feel free to start getting your questions in now, and we will get to them when we reach the discussion section of the agenda. You can go ahead and fill those out kind of throughout the presentation as your questions come up. And for now, we'll start by calling on each panel member to share their name, their role, and their organization with you. So let's get started with you, Darren.
Hey, good afternoon, everyone. I'm Darren Nelson Souza. I'm a board member with NAMI Washington. I'm also a licensed independent clinical social worker with lots of experience in medical social work, and I'm really glad to be here today. Thanks, Kristen.
Thanks, Darren. All right, Dana.
Thank you for having me today. I'm Dana Allard-Webb, and I'm the Family Caregiver Support Program Manager, and I work at Aging and Long-Term Support Administration. Thanks.
Thank you, Dana. Adrienne.
Hi, I'm Adrienne Cotton. I'm the Macintosoa Program Manager with the area Aging and Long-Term Supports through the State Unit on Aging. And I'm here to talk about the Medicaid Alternative Care and Tailored Support for Older Adults, which is a caregiver program that is modeled after the Family Caregiver Support Program.
All right, thank you so much. And it looks like we have one question about volume. Can folks please let us know through the Q&A function if you aren't able to hear us? I'm not sure if it's just that one participant or if it's more people. So if you're not able to hear us, please go ahead and send us a quick Q&A. I am going to go ahead and launch an opening poll for you all. If you have joined by computer, we'd love to have you answer these two quick questions just to help us understand who is in the audience today. And while you fill out your answers, we will just go ahead and do a quick overview of the topic today. So we're going to be talking about caregiver mental health. And when we talk about long-term care and caregiving, we're talking about help with activities of daily living like bathing, eating, dressing, and taking medications. This can look like a lot of different things. This can be paid care from a professional. It can be unpaid help, generally from a family member or friend or loved one. It can happen either in your own home or it can happen at a facility like a nursing home. What we're primarily going to be talking about today is unpaid care from family members, usually in the home. And while caring for a loved one can be really rewarding, it can also be a source of physical, mental, emotional, and financial stress. Most caregivers say that their situation is moderately or highly stressful. Nearly a quarter report that their health has worsened since taking on the role. And almost half reported a related financial setback, which is not surprising because caregivers spend on average 25% of their own income on care-related expenses. All right, we're going to go ahead and share the results of the poll so folks can see it. So it looks like we've got some folks who work in long-term care. We've got a good chunk of caregivers who either are providing care to a family member or loved one right now or have done so in the past. So hopefully this will be helpful content for you all. And it looks like our second question didn't make it into the poll, so that's all we've got. Okay. So we are going to go ahead and get started with our speaker remarks. And Darren, I will hand it over to you.
Excellent. Thank you very much. So I had said that I'm Darren Nelson Souza with NAMI, and I didn't explain what NAMI is. NAMI is the National Alliance on Mental Illness. It's the nation's largest grassroots mental health organization that's dedicated to building better lives for the millions of Americans who are affected by mental illness. What started as a group of families that gather around a kitchen table in 1979 has grown into the nation's leading voice on mental illness. We have over 600 offices around the country in 49 states. They work really, really hard to raise awareness, provide support and education to families and individuals with mental health conditions. Next slide, please. Excellent. So just some numbers, and they can be really, really staggering when we sit back and think about how many people are actually providing care for a loved one. And while our loved ones, our family members all have their own issues and mental health conditions, we really want to talk about the caregiver. So a bunch of us provide unpaid care. All of us that are caregivers, about 50% of us are caring for somebody with Alzheimer's or another form of dementia. 30% of the caregivers are 65 and older. So we're older taking care of older parents or older taking care of our children. Most of us are women. Most of us are daughters. And most of us live with the person with that mental health condition. And if you think about just caregivers by themselves, among all unpaid caregivers, 70% are experiencing a mental health issue right now. And 33% have probably very seriously considered suicide in the last 30 days. Next slide, please. So we know the challenges for caregiver. There's physical health problems, relationship issues, mental health issues, and financial problems. So being an effective caregiver is really challenging. It's difficult, to say the best. To meet the challenge, you have to take care of yourself. I know it sounds simple, but those of us who are caregivers know otherwise. There are many barriers to caring for yourself, such as just being able to set aside some time, finding some resources, and we all have that tendency to put ourselves last. So taking care of yourself is the most important thing you can do for your family, for your loved one, for yourself, and the rest of the family that's engaged with the individual. Not only do you have to care for your loved ones, you're also running errands, going grocery shopping, managing the other kids or grandkids and some other responsibilities. Oh, like maybe even a full-time job. As a caregiver, you have stress. Exclamation point, you have stress. But you're more likely to have increased physical health problems, mental health problems, relationship issues, and financial issues. Next slide, please. Burnout, burnout, burnout. So burnout is a huge factor. When you don't have enough support around you as a caregiver, navigating the healthcare system, the mental health care systems is tough enough on a good day. Add in the fatigue, the emotional exhaustion, physical exhaustion, stress, isolation, and a very, very demanding caregiving routine around a caregiving routine, and you are primed for a burnout. So what do you do when you get tired? Keep going, press on, fight on. What happens when you can't do it anymore? Keep going, press on. What happens when you need a vacation? You don't go, you press on. When we get burned out as caregivers, we tend to be short with our loved ones, maybe cranky with our families. Maybe we also withdraw from other family members and friends. And we know that we can't provide loving care, the care that we want to give to our loved ones and our families and ourselves if we don't have something to give from. So there is a decline in the quality of support and care. Those stress levels being high, sometimes We do things to help increase our escapism by maybe some riskier behaviors, maybe using some substances to kind of numb out and veg out for a bit. And then we obviously take less care of ourselves. And then, there comes that time when we just stop being us and we become something that we really don't want to be, or we have thoughts of running away, maybe suicide, or even wishing that our loved one was gone. Those are all some signs of burnout. Next slide, please. So let's just talk for a few minutes about some types of self-care. Taking care of yourself includes the physical activity, getting enough sleep, maybe taking a walk. One of the things that I do when I start feeling some stress is I'll just get up and walk in place through a commercial on TV. Just gets me up and makes me do something and focus my attention a little bit differently. Maybe just finding some time to do some stretches or yoga moves. I'm not a yoga person, but I know that there are. Just finding some time that you can just maybe burn some calories and take some extra steps and do something different for yourself. Even something as simple as getting good sleep and eating right really, really, really help with self-care. So caregiving, as we all know, can be an emotional journey. It's critical to recognize when you, the caregiver, need some emotional support from your family and friends, and maybe even some others who've been on the same journey that you've been on. Knowing that you are not alone and that others are there for you can provide you with the much needed comfort that you need. Taking care of yourself emotionally will allow you to find the strength to continue. Do something for yourself. Maybe find a support group or a stress management group. Maybe have coffee with a friend or go to dinner or a movie. Do something different and be kind and compassionate towards yourself and operate in what I call grace and forgiveness. So doing something with a friend or a loved one can also increase your social engagement. It's social wellness to be out and be friends with folks and do things in this time of COVID when we've all had to isolate so much. This is more important now than ever. We're not intended to be isolated and separated from those that we love. If you find that you're being isolated and socially withdrawn, ask for help. Say, hey, can we go get a coffee? Can we do something? Can we even sit here on the couch and eat popcorn and watch a movie together as a good break? It also allows you to set some boundaries with your loved one so that you can get some me time. And I'm here to tell you, me time is not a selfish thing. It's a necessary thing, and it does so much for our mental health. We also have spiritual journeys, many of us, and it can take any kind of form that you want it to, from prayer and meditation to walks, yoga, being out in nature, journaling, being in some sacred space, attending a worship service. Holding a sacred space for you allows you to recharge, to reconnect and refresh your own well-being. So taking care of yourself also means taking care of your finances. So you'll want to make sure that you're managing those out-of-pocket expenses that can quickly add up, making informed decisions so that you feel more in control of your own finances and life can be a big help. It also helps you plan for the future. So I also wanted to leave you with just a few thoughts about some resources. www.namiwa.org is a great place to look for some mental health support. The Hearts and Mind program makes the whole body-mind connection and gives you some more additional tips for self-care and wellness. Frontline Wellness also talks about how it is to be kind of a frontline worker when you're taking care of someone at home. And then there's the Circle of Care guidebook that was put together by several organizations in NAMI. It's a great place to get some more resources and support. And just thank you for the time today to listen to me, and don't be afraid to reach out and ask for help. Kristen?
Thank you, Darren. All right, I am going to hand it over to Dana next.
Hi, everyone. As I said, I'm Dana Allard-Webb, and I'm the program manager for the Family Caregiver Support Program. Next slide, please. There are over 860,000 unpaid family caregivers in Washington, and you may be one of them now or in the future. Or as you age, you may need care from a family caregiver. If you help another person live in their home more independently, if you do tasks like make runs to the pharmacy, help someone with walking or personal care, do some shopping for groceries, prepare meals, help with banking, or do household chores for a family member, a friend, or a neighbor, and don't get paid for your assistance, you are a family caregiver. The work that unpaid family caregivers do saves the state of Washington more than $8 billion a year, every single year. And by the time most caregivers reach out, they are extremely stressed, as Darren was talking about. And about 40% of our family caregivers have symptoms of depression. If caregivers receive supportive services like breaks from caregiving that we call respite, or education on a myriad of caregiving techniques or advice, referrals to other programs earlier in their caregiving journey, they can end their caregiving journey with better physical and mental health overall. With current federal and state funding, we're only able to serve about 3% of caregivers, of family caregivers. And that's why I am so excited to see WaCares come about. Next slide, please. The web-based Community Living Connections of Washington steers older people, family caregivers, and disabled people to our partners, the Washington's Area Agencies on Aging. The Area Agencies on Aging provide information, referral, case management, assessment, and other services across the state for people who are aging or disabled or are family caregivers. The Area Agency on Aging, through our Community Living Connections, should be the first place you search for services and supports for aging people or for family caregivers. Whether you look for them, whether you look for the Area Agencies on Aging in your area on the internet or by phone or in person. The Community Living Connections is going through a remodel right now and should be done by the end of the year. But in the search section, you can just put your county that you live in and it will come up with the contact information for your Area Agency on Aging. Next slide, please. The Washington Legislature's priority population for this state family caregiver support program is unpaid family caregivers whose care receivers are not receiving Medicaid-funded long-term care services like Community First Choice or McIntyre. We recognize the person giving care to a care receiver as that care receiver's family, whether it be a family member, a friend, or a neighbor. The bottom line is if you believe the person is your family, we will too. And we serve long distance caregivers if their care receiver lives in Washington. And there is no income cap for the Family Caregiver Support Program, but there may be a cost for respite services according to income of the care receiver. So contact your Area Agency on Aging for more information about the Family Caregiver Support Program or our other family caregiver programs, which Adrienne Cotton is going to talk about in a few minutes. Next slide, please. The Washington, let's see, sorry. Whoops. Caregiving can be very rewarding, and it can also be have harmful effects on family caregivers. We know that 40% of our caregivers, or at least 36% of caregivers, say they suffer from depression and anxiety, like Darren was talking about. And anxiety rates and chronic diseases are at higher rates for non-caregivers for caregivers as well. Next slide, please. Sorry, I got lost here. Caregiving, let's see. So sorry. The supports and services that we offer to family caregivers are helpful in many ways. We use an evidence-based assessment process that measures stresses and recommends services and supports that help the caregiver reduce stresses from caregiving. 84% of our family caregivers see reduced stress levels after using the FCSP, the Family Caregiver Support Program, for 6 months at least. It trains, some of the services are for training caregivers in caregiving skills, communication skills, and future planning. We also encourage self-care, which you can see a list of on the slide right now, and asking for help from others if it's available. Next slide, please. I talked about this one already, sorry. The Washington Lifespan Respite Program, voucher program, awards vouchers of up to $1,000 for unpaid family caregivers, 18 and older, caring for a care receiver of any age. And these vouchers can be used for respite services from one or more organizations that are on a list of contracted respite providers. And all of those contracted respite providers have been vetted and as safe to use as providers. Choices include in-home care, camps, park and recs programs, and in Eastern Washington, there is even a horseback riding therapy option. To see if you qualify or to ask questions, please visit the web address on this screen or call the phone number to talk to a respite specialist. Next slide, please. A new service that is free to any unpaid family caregiver in Washington is the TrueAlta, which we call the Washington Caregivers Learning Portal. To sign up, you only need to provide your email address and your own password that only you will know. There are a list of short training modules on a huge variety of subjects, including self-care for family caregivers, lifting techniques for caregivers, dementia-specific training, diabetes, and other diagnoses that are specific to caregivers, planning for the future, and many, many more. And you can, can you go back one, sorry. And you can sign up at this address. It says sign up for free underneath. Okay, next slide, please. Okay, that's the end of mine. This is Adrian's.
All right, Adrian, go for it. Looks like we've got you on mute though.
The silly mute button. Anyway, yes, my name's Adrian. And so just kind of going off from where everybody else has left off, is one of the most challenging things for people is when we're trying to provide programs supporting those caregivers, is them not understanding or recognizing or identifying with the word caregiver or being a caregiver. They may primarily identify as being a friend or a family member, a spouse, a significant other. And oftentimes, sometimes we refer to as the care receiver, which is the person that's receiving the care, doesn't always realize that they have a caregiver, many people identify with home care agencies. That's where the caregivers come from. These are people who get paid. And so we actually put out this promotion, this outreach to help people who are unpaid family caregivers understand and realize that they too are caregivers, and that there are services and supports to help them, to support them in their caregiver journey. Our first step is trying to help out over 850,000 identified unpaid family caregivers that are in the state of Washington alone. And so we have had these put out on billboards, on buses, movie theaters, where it says, you know, you call it helping my dad pay his bills, we call it caregiving. Here's our contact number. You can go through the CLC site that you saw a brief picture of that Dana had provided, and they can reach out to their local area agency on aging to find out how they can get these services and support set up for them. Next slide, please. So they can also go through, they can actually get involved in these particular programs, or MTD, which is the Medicaid Transformation Demonstration Project. It's been a 5-year project that we're extending into the next 5 years. And they can actually come through the AAA door, which is the Area Agency on Aging door, or they can come through the Home and Community Services door. Once they go through the intake process, which is based on self-attestation in terms of their the care receiver's nursing facility level of care. There's a few questions they ask on that. And they also have a self-attestation for what's called presumptive eligibility, which is to talk to them about how their income and their resources may help them be presumptively eligible to come into the program before getting all the final financial paperwork taken care of through the process. Once they're in the program, then the Area Agency on Aging case managers take over the case, and they do all of the assessments, the screenings, the care plans, and set up all the service authorizations for the services. Next slide, please. So presumptive eligibility, a little more on that, is a process. It's similar to what would be referred to in the long-term care world as a fast track, a quick way of allowing preliminary information to be gathered to determine if they're eligible financially and functionally based on that attestation. And in which case, if they do qualify, they can start receiving services as soon as those services can be set up. The people that are can qualify for the Medicaid Alternative Care or Tailored Support for Older Adults program. The care receiver needs to be 55 years or older. If it's MAC, they need to be enrolled in an Apple Health or an ABP coverage group. They need to fit the nursing facility level of care assessment process and qualify through that, which is usually done at intake. And it also does need to be a caregiver and care receiver, what we refer to as a dyad. So it's 2 people, and it's 2 clients we serve. We serve the care receiver and the caregiver. And then, of course, they have the presumptive eligibility. Under the tailored support for older adults, they do need to be 55 and older for the care receiver. Caregivers in either program can be 18 years or older. The TSOA program, they must have a monthly income less than $25,23. As a single person, their resources need to be under $53,100, and as a married couple, under $112,990. Meet the nursing facility level of care. It supports both the dyads, which is the caregiver, care receiver, and a new group of folks is the individuals who don't have an unpaid family caregiver, which is a new population that we've served outside of the long-term care services system. And then you do have to submit an application to go through the financial full eligibility process to determine if you're able to be eligible financially to continue with the program beyond that presumptive eligibility period. With these programs, there is no participation to pay, and there is no start recovery. And there are several things that, unlike with long-term care, they don't take into account in determining that functional eligibility. So it makes it a nice program. It is a small service program, so I'm going to have them go to the next slide. So it's a very small benefit package. It's not intended to provide a huge amount of services, but some people just need a little bit of help. They just need a little bit of support, whether that's an unpaid caregiver, that unpaid family caregiver just needs maybe a support group or a caregiving class, or they need to get home delivered meals because preparing meals is a big challenge. So care receivers and caregivers can choose services up to the amount allowed for the step that they're approved for, which is based on how they do their screening and assessment. So it's $250 one time for a lifetime if they qualify for step 1. If they qualify for step 2, they get up to $500 per year. That could pay for a wheelchair rack to put on the back of the car for a scooter. It could go towards, some different things that their regular medical doesn't cover. And then step 3, it's an average about $759 per month, which changes every 6 months based on the home care agency rate. And that can usually get an individual about a maximum of 20 hours of respite for that unpaid caregiver to get a break each week. About averages about 5 hours a week where they can get a break to go run errands and do other things for that. And that rate, they can also obtain up to 6 months at a time of that budget. Maybe there's that care receiver they're caring for has surgery, so there's more time where they need more support to run errands, or having that caregiver help get that person to medical appointments because the caregiver has to work or run the kids somewhere, that kind of thing. And so it's an opportunity to be able to utilize those funds as needed for both that unpaid family caregiver as well as to support that care receiver. The next slide, please. So this is just a brief overview of some of the services that can be provided under the McIntyre program and even under our family caregiver support program as well, which is our other caregivers program. And so it can provide, in terms of dyads, is the respite care services. And that is for people who do have that unpaid family caregiver, that caregiver, care receiver, dyad piece. And that can provide respite services, home delivered meals for both the caregiver and the care receiver, home modification, wheelchair ramps, yard work, housework and errands, adult daycare. Under the TSOA only without a caregiver is the personal assistance services, which again is like adult day health, transportation, home delivered meals. And then we also have our training and education, which is really important for a lot of caregivers to get that consultation, do long-term care planning, and attend those support groups like your mental health support groups, mental health counseling, dementia and Alzheimer's support groups, and things like that. Health maintenance and therapy, such as massage therapy and acupuncture, again, adult day health and counseling. And the massage therapy and acupuncture, if it's available through that area agency on aging, and just to keep in mind that not all of these services will be available in all areas because they do have to contract with a variety of these services. If they are able to, that massage therapy and acupuncture is good for both the caregiver and the care receiver. So that makes that nice. And then we have our specialized medical equipment and supplies, which includes your durable medical equipment like benches and grab bars, PERS, which is personal emergency response systems that can include medication management, fall prevention, and then any additional assistive technology and equipment, which one of those can include for the dementia and Alzheimer's folks is the robotic pets, which is a program that we have offered through our caregiver programs that we have available here in Washington. And that is all I have. So next slide, and we're on to Lynn.
All right, Lynn, take it away.
There we go. I'm Lynn Cordy. I am the Dementia Care Program and Policy Manager at Aging and Long-Term Support Administration. So I work alongside Dana and Adrian. And one of my roles is to provide oversight and coordination of our Washington State plan to address Alzheimer's and other dementias. So this includes managing our Dementia Action Collaborative. And that's a group of 40 or more organizations, both public
Lynn,
and
this is Donna, the interpreter. Can you slow down just a little bit? I'm having a hard time keeping up.
I realized we were running very short on time here.
Okay.
So I'm with a group of more than 40 organizations that are both public and private from throughout Washington. And we work together to implement our state's dementia plan. And we've been working on creating resources to help families who are navigating the journey of dementia. So what's important to recognize is that while not all caregivers that we're thinking of are caring for a person with dementia, many are. And we estimate around 300,000 family members who are caring for persons living with dementia in our state. So as others have already discussed, the potential stressors and impacts on mental health of caregivers, you've already heard all that. And I want to share a little bit of insight into how it can be a little different when you're caring for somebody with dementia. So our Dementia Action Collaborative has been recognizing that there are really some specific challenges and stressors for people who are caring for or living with somebody with dementia in their families. For example, caregivers of people living with dementia provide more care. They provide more care and sometimes more difficult care over a longer period of time. And that's because dementia can go on for many, many years. The situation with dementia also is constantly changing. So there's new care needs or behaviors that emerge over time. And some of these behavioral symptoms of dementia add a certain type of stress. So it can be sort of not just a physical strain, but also an emotional strain or a strain on the relationships and the dynamics within a family. So also with dementia, there are some specific concerns about, say, the stigma of dementia or the financial concerns of the cost of care, again, because of the length and the type of care that people need, and or the isolation that's created from the condition. Because one thing we know about dementia is sometimes friends and family can fall away over the time. Some people are uncomfortable being around somebody with dementia and seeing those changes. So in our state dementia plan that I mentioned, we heard about all those concerns and issues and worries from family caregivers that we had come across. And we had one family caregiver who just told us so articulately that when his wife was diagnosed, he didn't know where the disease was going. He hadn't gotten any information about it. He didn't know what to expect. He didn't know where to turn. And he said, I just simply needed a roadmap. So that's what we developed, and that's what I want to share with you today. If we could go to the next slide, we created what we call our Dementia Roadmap, a guide for family and care partners. And the intent is to respond to all those things I just mentioned, those special worries and concerns around dementia. And it's designed to help families know what to expect on the road ahead and to outline some of the guidance and where you can turn and some action steps you can take along the way. We currently have this available in both English and Spanish. And what people most like about it, what they've told us, is that while it is comprehensive, providing a lot of information, it's written in a very easy to digest way. It's action-oriented, and it really does empower families throughout the course of the condition. So if we go to the next slide, I'm just showing you a couple pages. If you were to open it up, what you can see is that the design of the Dementia Roadmap is intended to be useful at any stage. So it might be very early on when you're just worried or wondering what is going on with this person, how these changes are impacting them. And then you sort of go through the diagnostic process, and it offers tips, guidance, tools, resources through the early stages, mid, and later stages of dementia. So while we really believe that even there's no cure for dementia, there really are things you can do at any of those stages along the way to help a person living with dementia and or their families. So if we go to the next slide, what you can see is that it's written in a positive and empowering light. We have sections at each stage focusing on what you can do for your family member and or for yourself as a family caregiver. So it considers the strengths of people living with dementia and what the family can do instead of what they can't do or what they can't control, which is where all that worry and stress comes in, right? So it's written in a way that you can take hold of something and take some action to help the situation. If we go to the next slide, we can see another sample of a couple other pages. And what you can see is that at each stage, no matter where somebody enters or gets this book, whatever stage that person is in, it highlights helpful services, suggests helpful services that could be helpful at that stage, such as Alzheimer's support groups, powerful tools for caregiving classes, STAR-C behavioral consultation, or just a dementia consultation service. And all those things have been mentioned that Dana and Adrian mentioned. We talk about those sort of in the context of these different stages. And we provide links right on each of those pages. How could you find that service in your community? We provide that information right at the bottom of the pages so that once you get that idea, you would know where you might be able to call for help. If we go to the next slide, what you're going to see in the Dementia Roadmap, we also, throughout it, offer the resource that's available called the Alzheimer's Association, and that is a private organization that specializes in dementia. They have a lot of resources out there. And the reason I want to mention it is because what a lot of people don't know is even if you can go to their website, you can do e-learning, but they also have something called a 24/7 helpline. And on that line, you could call at any time. You can call if you're a paid provider, an unpaid family caregiver, and you can get help and talk through a behavioral issue. You can ask about treatments. You can ask about warning signs. You could get help on how do I talk about this with my physician. It's a great resource, and a lot of people don't know about it. It's 24/7 free helpline. Translation services are available. So I just wanted to highlight that as well. If we go to the next slide, there's just a couple other things I want to mention because the Dementia Action Collaborative has developed other resources to help relieve some of that stress and worry that we talked about. For example, we have some resources to help families do some of their important legal planning early on in the disease process. And that's very important to do some of that legal planning while the person has the capacity to do that and to say their thoughts and what they want in the future. So what you see up here on the screen is our Dementia Legal Planning Toolkit that is available for free. It offers information, guidance, and it actually is a folder that has forms in the back, powers of attorney for health and finances, and also a form for healthcare directives. Another thing you see on the screen is our Dementia Legal Planning Service, and that is a new program, and that is available to anybody who is 60 plus or has dementia of any age. And what we do is we provide a link to free or pro bono attorney services to help complete powers of attorney or healthcare directives. They can't go beyond that with legal assistance, but you can get an attorney to help you fill out those legal forms early in the disease process so that that worry is off your plate and that you have somebody who can make decisions for the person with dementia as the disease progresses. I am going to put the resources in the chat after I get done speaking here, so you'll have those. And if we go to the next slide, I'll just point out a couple other real useful tools that we created. One is called Partnering with Your Healthcare Provider. It's a self-paced online training to help families have better conversations and know how can I work with my health provider to get the very best care for somebody with dementia. It provides checklists, tools, communications, ways you can track what's going on with the person. So it's free. Again, I'll provide the link at the end of my slides here where you can find access to that free training. And then we have something called our Dementia Safety Info Kit, because with dementia, as we all know, there's issues around driving, there's issues around, when they should stop driving, there's issues around falls, there's issues around wandering. And so we've compiled a whole lot of resources into this Dementia Safety Info Kit, and that is just available online. Anybody can access that on our webpage. So we have other resources that might be helpful to you, including some caregiver tip sheets that offer some ideas around behaviors, available in English and Spanish as well on our website. So any of these can be found on our webpage, which is listed up on the screen. And my name is there. If you try to find something and can't get to it, happy to try to point you in the right direction. So that's what I have to share today, and pass it back to you guys.
All right. Thank you. Thank you all. And I know there have been just some really fantastic resources shared in these slides. You will also be able to access these slides on our website at wacaresfund.wa.gov/learn-more. That URL will be at the end of the presentation. And I think maybe we can put it in the chat for folks as well. Julie, if you don't mind doing that, so that people can make sure that they are able to get to all of these great resources that we've been sharing. So I want to talk really quickly about how the WA Cares Fund will be able to help with this issue. WA Cares, as we said at the top, is a new universal long-term care program in Washington State. It's an earned benefit, which means that you contribute for a certain number of years and then you qualify for benefits. It's entirely self-funded from worker contributions, and you only contribute while you're working. Contributions stop when you retire or if you become unemployed. Everyone is covered at the same rate, regardless of pre-existing conditions. And when it comes time to claim your benefits, there are no copays, no deductibles, and you never need to file a claim. We connect you with contracted providers for the services that you want and pay them directly. Contributions to the program will begin in July 2023, and benefits will become available in July 2026. Almost all Washington workers will be contributing 0.58% of their paycheck to WA Cares, and you can see what this looks like for the typical worker on the right here. Someone who makes the typical income of just over $50,000 a year would contribute $291 each year. The premiums that workers contribute go into a dedicated trust fund that's used only for this program. There are a couple of groups that are not automatically included, and that is federal employees. Employees of tribes are only included if the tribe opts in, and self-employed people also have the option to opt into the program. There are some groups of workers who can apply for an optional exemption, including workers who live out of state, temporary workers with non-immigrant visas, spouses of active duty military, veterans with a service-connected disability rating of 70% or greater. And then finally, there was a window of time for workers who already had private long-term care insurance before November 1st, 2021 to apply for exemptions as well. And this is what contributions to WA Cares look like over the course of a career. You can see typical Washington income is just about at that level in green there in the middle. And you can see that 290 in contributions each year totals out at 8,700 over 30 years. Everyone who is contributing to WA Cares Fund more than 500 hours per year is earning benefits, part-time and temporary workers included. There are 3 different pathways that you can use to meet contribution requirements and qualify for the benefit. And the first pathway is early access, which is for workers who have not yet been able to earn lifetime access, but have a care need either while they're still working or soon after leaving work, which is for folks who have contributed 3 of the last 6 years at the time that they need help and apply for benefits. The second pathway is lifetime access, which is for workers who contribute for 10 years without a break of 5 or more consecutive years. And then finally, we have what we like to refer to as a fast track for near retirees. So for folks who were born before 1968 and are near retirement as the program is beginning right now, therefore are unlikely to be able to qualify for the 10-year pathway. This group earns 10% of the benefit amount for each year that they work and get permanent access to the benefit at any time they need it. Once you meet contribution requirements and need help with at least 3 activities of daily living, you can get access to a $36,500 budget for services and supports, and that benefit amount will increase over time with inflation. With WA Cares, you get the flexibility and freedom to choose the services and supports that you meet your needs. And that could mean in-home or residential care, but it could also include home modifications to make your home safer, assistive technology for things like medication reminders and fall detection that can help with some care needs. And really, Walk Here is designed to help people age in place in their own homes as long as possible. That is what almost all of us want to do and what most of us are able to do if we have the right supports in place. Walk Cares is also structured to support family caregivers. You can choose someone who would otherwise be caring for you on an unpaid basis to get training and be paid, even your spouse. And Walk Cares can help lessen the impact on family caregivers in that way by either paying them for their time or making sure that they can get other support services. We get asked a lot about how far that benefit will go. And the truth is that it won't cover 100% of care for everyone, but it would cover 20 hours per week of home care for about a year. And 20 hours is the amount of in-home care that our average Medicaid client receives right now. About a third of people need long-term care for a year or less. And for those people, Walk Cares could cover all of the care that they need. For other folks, Walk Cares provides the family with immediate relief and time to plan for future costs. All right, so it is now time for our Q&A. It looks like we have only got a couple questions. So if you do have questions in the couple minutes that we have remaining, please do go ahead and drop those in the Q&A. We do have a question, Lynn, I'm not sure if you'll be able to answer this, and it's fine if you're not, but we've got someone asking, when a long-term care facility wants to get rid of a resident who has dementia and becomes violent, where can that resident go? Is that something you'd be able to answer?
Are you saying where can you go for help, or where can they go to live?
Looks like where can that resident go to live? But I think maybe also if there's somewhere that that person can go for help, that'd be great.
You know, there have been some special enhanced service programs for people with dementia or other issues that can't live and managed within their home setting. And I would encourage that person to call HCS and find out if there is one of those enhanced service facilities in their area. If they have a case manager, would go to the case manager and ask about that, because there might be some sort of, there have been some resources being developed. There's only a handful throughout the state, but that are really designed to take people who have some specific, more difficult needs.
Thank you, Lynn.
Sure.
All right, and Adrian, we've got a question for you. When did TSOA start covering individuals without a family caregiver, from someone who hadn't heard about that change?
Actually, that service has been available since the start of the program, or the implementation of the program in 2017. We started September 11th. So that has been part of the program the entire time that we've been implementing it, the last 6 years.
Great. Okay. That is all of the Q&A that we have got, and we are just about at time. So thank you all so much for joining us. For a recording of this webinar and other resources, including the slides from the presentation, you can visit our website at walkcaresfund.wa.gov/learn-more. And if you scroll down into the chart that's on that page, you'll see this webinar listed with those links for you to reference back to. Thank you again to our panel for all of the wonderful information that you have provided. And we will see everyone next month for a conversation about income inequality and caregiving. Hope you all have a wonderful afternoon. Thanks so much for joining.
Thanks, Kristen. Bye.